Okay, good morning, everyone. Welcome to the seminar on the national security community's response to the COVID-19 pandemic. This is a joint presentation by CIPS, the Center for International Policy Studies, and the Canadian Association of Security and Intelligence Studies. The panelists this morning are contributors to a book that will be coming out later in the spring on this subject, on the national security community and the pandemic. Our speakers this morning have been described in the website, but I'll just briefly note who they are, and they will appear in this order for opening statements of about 6 to 8 minutes, after which we will turn to questions and answers. So Julianne Piper is a research fellow and project coordinator in the Faculty of Health Sciences at Simon Fraser. Her research interests are global health security, global health governance, and public policy. Simon Wallace is a PhD student at Osgoode Hall Law School, and he's formerly an immigration and refugee lawyer. Diana Reyes is a PhD candidate in international health at Johns Hopkins Bloomberg School of Public Health, and she specializes in the impact of conflict and displacement on refugee and immigrant health. Tara Hansen and Michael Nesbitt will be making their presentation jointly. Tara is completing her second year at the University of Calgary in the Faculty of Law, and she has an interest in national security policy as a career later on. And Michael Nesbitt is a professor at law at Calgary Faculty of Law and teaches and researches in the area of criminal law, national security, and terrorism, anti-terrorism laws. So with that, I'll call on our panel to start the presentations. And Juliana, over to you.
Thanks so much, Greg, for the introduction. Really happy to be here with everyone. I'm going to speak today about Canada's Global Public Health Intelligence Network and sort of what should have been its critical role in Canada's response to COVID-19. So I'll just give a bit of background information before sort of suggesting three thematic areas raised by GFIN in Canada's COVID-19 response. That are particularly relevant, I think, to Canada's national security community. So GFIN is an events-based disease early warning system that through a semi-automated process gathers, analyzes, and disseminates alerts to its subscribers on media reports of outbreaks or infectious diseases, as well as some other types of health risks from around the world. GFIN was created in the 1990s by Canadian public health officials in collaboration with the Nuclear Threat Initiative based in Washington, D.C. And it was initially motivated by the realization that through the transformation in the communications technology sector, informal reports about disease events were outpacing, formal reporting processes between national governments and the World Health Organization. So GFIN provided 24/7 coverage of global media reports on health events, scanned an estimated 2,000 to 3,000 sources per day in the 7 official languages of the WHO. And using a combination of computer algorithms and human analysis, it would send alerts of relevant events to subscribers around the world. So why does this matter? I mean, epidemic intelligence gathering, I probably don't need to tell this audience, is a critical and early step in disease detection, prevention, and response. It's essential to health security. At the global level, the WHO, the World Health Organization, is responsible for this mandate under the scope of the International Health Regulations, or the IHR. And these govern how countries and the WHO respond to the international spread of disease. Prior to the creation of GFIN and similar internet-based disease surveillance systems, the WHO relied on paper-based reporting mechanisms from official government sources. So GFIN really revolutionized the field of epidemic intelligence gathering. It was a semi-automated capacity, so it had the capacity to process much larger amounts of news data much faster, and sometimes could potentially identify threats before governments even realized they were happening. It significantly reduced the time period between detection and reporting of disease events, and it really strengthened the WHO's position as a coordinator of global responses to outbreaks and epidemics. And then finally, its reliance on unofficial and public sources of information meant that it disincentivized states from holding back or withholding that information and sort of reduced their control over when and how it was shared. So given this sort of robust public health capacity, the question is, why wasn't this mobilized in the way that it could have been in the days and weeks leading up to the COVID-19 pandemic in 2020? You know, quite the opposite. It became immediate or apparent in media reports that the department within the Public Health Agency of Canada, within PHAC, that was responsible for overseeing GFIN had actually curbed its capacities and reduced its impacts in the years leading up to where we are now. So the government has responded by launching an independent review of GFIN to better understand sort of how we got here and where we're going. And we still want to know some answers to these million-dollar questions of why GFIN wasn't mobilized as holistically as it could have been in the days leading up to COVID. But I think it's also important to contextualize this within the broader global landscape of health. The first is that many similar and competing digital surveillance systems have emerged for internet-based surveillance. Some prominent examples of these include HealthMap or ProMed. Secondly, the rapid evolution of communications technology combined with political and financial challenges faced by the WHO meant that there were a lot of competing sort of relationships bilaterally and regionally, as well as between disease surveillance institutions that sort of bypassed the global coordination role of the WHO. And then the final piece is that, you know, against a backdrop of burgeoning data sources and rapidly changing technologies, maintaining GFIN isn't just about maintenance. It really requires a lot of investment to keep up with the pace of technology, and that it's probably not ever going to be a fully automated process. So it also requires investment in human resources. So then finally, to conclude, I'll just introduce sort of the three themes that I think this draws on that are relevant to the Canadian security community. The first is a need to sort of rethink the interface between health and security. You know, the analogy of firefighting has been used widely in different analyses of the COVID-19 response. And I think as Canadians, we accept the importance of training and paying firefighters, investing in the infrastructure of fire departments, even when the fire isn't burning. And our approach to public health capacities and health security needs to follow the same logic. You know, while the global health security agenda has become increasingly prominent over the last 2 decades, I think there's still a lot of work to be done in terms of creating a common ground and identifying and defining the collective investment and action required to bolster it. The second may be obvious, that it's about more than early warning signals. So, you know, while GFIN could have mobilized signals a few weeks or a few days earlier in December 2019, it's also about how that information is shared, how effectively it's shared, and how efficiently it's acted on. So, you know, in Canada, I think it signals a need for continued investigation into how we coordinate this information sharing and action across different ministry capacities and capabilities, and across different jurisdictions in terms of federal, provincial, territorial, etc. And then finally, I'll just end on the importance of multilateralism and global solidarity. One of GFIN's significant early knock-on effects was underscoring multilateralism and solidarity in global health. So essentially serving as both a vote of confidence and contribution to WHO's capacity, but also contributing to both Canada and global health security. So just that, you know, in a globalized world with incredibly permeable borders, public health emergencies and how we respond to them can't be confined to national policy. We need to invest in our capacity to coordinate among and between countries. Thank you.
Thanks very much, Julianne. Simon Wallace, over to you.
Thank you. I'll just pull up my presentation here. So the Canadian Border Services Agency is, let me just do my meteorologist thing. The Canadian Border Services Agency is a huge organization charged with a number of important functions. I want to talk to you today about one, deportations, and what happened to deportations during the COVID-19 pandemic. So what happened to deportations during the pandemic? At the beginning of the pandemic, you may have noticed a news story that the CBSA said that they're going to fundamentally pause the deportations program, which made sense. The planes were grounded, international travel was dramatically slowed. But then recently in the beginning of the year, there were also news reports that in fact, deportations had gone up significantly during the pandemic. In particular, it looked like, based off reports from Reuters, that during the pandemic or during calendar 2020, more people had been deported since 2015. So really, this presentation is what gives. What happened during the pandemic to account for this spike when ostensibly the CBSA said it was deporting fewer people? I want to begin, though, just by summarizing what is deportation. This is the best normative definition, I think, out there. That deportation is fundamentally about the use of coercion, about force, to get someone who's breached immigration law or criminal law back to their country of citizenship. The CBSA is the governmental organization charged with enforcing the laws. And this is the section of the Immigration and Refugee Protection Act that empowers the CBSA to do its job. What I want to highlight for you is this last part. The CBSA's job to enforce a deportation order as soon as possible. I'm a lawyer. Let me tell you that we read a lot into as soon as possible. So for example, let's say there was a global pandemic and planes were grounded. It wouldn't be possible to deport someone. Or a more common example pre-pandemic, we wouldn't deport someone if they had a child in school and they were waiting to finish the school year. We'd say that wasn't fair or appropriate. We can do a lot with that last part, is what I'm saying. So what happened to deportations during the pandemic? This gives you a snapshot of the number of removals in the last fiscal year we have before the pandemic. What you can see is approximately 9,500 removal orders executed. 2,800 were at the port of entry, just over 1,200 for serious inadmissibilities, terrorism, security, but the vast majority of those are criminality, 3,600 criminality, and then 1,800 for visa overstays and things like that. Now, during the pandemic, so I've been able to obtain the data here from March 31st to November 26th, so 8 months during the pandemic. It looks like deportations are actually sort of up. And what we see is that they're down in the removal in the port of entry category, down in the serious inadmissibilities, but there's this new category, voluntary removals, and then another one, administrative removals. And the final numbers are actually quite high, 7,200. So what happened? So here we can look at the port of entry removals. We see these are down significantly. A port of entry removal really, though, as far as I'm concerned, is not a deportation. It's someone who presents themselves at an airport, at a port of entry, a land border, and is refused admission, and an order is executed requiring them to leave. But again, we see it's down. I don't think there's a lot going on here. The second category, serious inadmissibilities. The CBSA, when they said that they were going to pause the deportation program, said that they would still remove a few people who were inadmissible for serious reasons. And we see that happen, but again, the numbers were way down in the neighborhood of just over 150, way down from what was going on the year before. This is the interesting category, though. There's this new, like I said, I'm a deportation defense lawyer, this new category of deportations I had never really heard of, voluntary removals, when a subject person approached the CBSA with a request to leave voluntarily. What do we make of this? My question is, were these really actually voluntary? If they were voluntary, I don't know if they're really deportations. So how do we assess the voluntariness of these removals? Well, one, what you can do if you're subject to a deportation order is you can go to court to stop it. What I have here are the numbers of people who went to court to ask the court to stay the removal. And what we see, sorry, I'm mirrored here. is that when the pandemic began in March, there was a dramatic decrease in the number of people who went to court asking for the deportations to be paused. This to me indicates that this category of voluntary removals may actually be voluntary, not really deportations at all. And then what we also see is, this is the deportation power, where the solid bars show you the number of aggregate days spent in immigration detention. The line shows you the number of people in immigration detention. Huge drop off in the use of the detention power with the pandemic. To me, again, this suggests that the program became less about coercion, less about force, which suggests that this claim that there were 1,200 voluntary removals is probably true. Probably people were approaching the CBSA to leave, but I say not really a deportation. The final category, the interesting one, this is where there was a big spike. If this big spike of people, that 7,000 people, were actually deported, that would suggest something really significant was happening during the pandemic. But when we look in, I think there's something else interesting going on. So what is an administrative removal? It was the case before about 2018 that when someone left Canada and had not told the CBSA that they were leaving, but there was a deportation order, the CBSA didn't have the regulatory power to close the file. And there was a huge backlog of files which which remained open, even though the CBSA knew the person had left the country of their own initiative. During the pandemic, a lot of enforcement officers were at home, and what the CBSA reported was that they were doing desk work. They were closing a lot of files of people who had already left Canada for years before. And this, I think, explains this category of administrative removals. Why is this important? Actually, I want to come back to this in a second. So what does this show us? Bottom line, port of entry removals down, serious inadmissibility removals down, voluntary removals up, but not really even deportations at all. Administrative removals up significantly, but they don't actually refer to a deportation that's happening during the pandemic. It's something that happened years ago. What do I think we're really seeing? We found out at the beginning of the pandemic that there were all sorts of problems. This is an Auditor General's report I've excerpted here. All sorts of problems with the integrity of CBSA's data, its ability to run its program. What we're seeing and what the administrative removals numbers show is that the CBSA's used the pandemic to retool, to clean up its database, to be better, to be more efficient as we leave the pandemic. Is this right? This is the question I want to leave you with. Joseph Cairns is one of the leading Canadian scholars on this, and he makes, I think, an important point for us all to consider as we think about deportations and the pandemic. People who have stayed in the country for a while, who have endured something, are probably people who morally shouldn't be responsible, shouldn't be deported, or at least the case for deportation certainly gets attenuated. So it concerns me, and I think it should concern all of us, that the CBSA has taken the opportunity presented by the pandemic to retool, to get better, at the precise moment when the case to deport people should be, I think, reevaluated. People were here and during a pandemic have established themselves. That should matter. What do I want to leave you with? Recall at the beginning when I showed you the slide about the CBSA's legislative power to deport people as soon as possible. I think we should encourage the CBSA to think of possibility in very liberal terms. If the CBSA wants to deport someone, but they learn that that person's become established and is making some sort of application to stay in Canada permanently, I would urge the agency to stay back, to use a softer touch with a lot of these cases, because I think it would be morally wrong if the more efficient CBSA just turned around and started deporting a lot more people after the pandemic. I look forward to your questions, and thank you for letting me be a meteorologist for this time.
Okay, thanks, Simon. It's over to you, Diana.
Thank you very much. I would have to say that's a tough act to follow, Simon, having you cast yourself on your screen. I'm afraid I can't do the same. but this will have to do. Thank you so much, Greg, and thanks to my fellow panelists for already starting the conversation on the importance of data and the integrity of data. I'm going to dive a little deeper on COVID-19 data disparities and implications for at-risk communities in the US and Canada. As Greg mentioned, I'm a PhD candidate at the Johns Hopkins Bloomberg School of Public Health. I'm based in DC. And a lot of this work is based on my experience this summer being a policy volunteer for the Biden-Harris campaign on a specific subgroup and working group that was dedicated to highlighting COVID-19's disparate impacts on particular communities, especially communities of color and marginalized groups. And a lot of this was really inspired by some of the disparities in data that were put out by the CDC. So I thought I'd start by highlighting some of the demographic trends of COVID-19 cases and deaths that are reported by the CDC. And we'll start here with age, which is as expected. You can see the different breakdown of age group and years based on cases and deaths. The CDC has age group data available for 99% of cases and deaths. Similar to data on sex, so not gender, but sex specifically, we have sex data available for 98 to 99% of cases and deaths. And it's important to mention that while we do have data on sex, we don't have data on gender, which would have different implications for various gender groups. Now, where it gets tricky is we have this data, this is as of yesterday, published by race and ethnicity groups, so different breakdown by race and ethnicity across cases and deaths. Until today, race and ethnicity data is only available for 52% of cases. So when you look at this chart here on the left, you can see that white non-Hispanic groups make up the majority of race and ethnic group with COVID-19 cases, but that's not quite true, and I'll show you in a future slide. Similarly, for deaths, we have race and ethnicity data for 74% of deaths. So that means 25% of data broken down by race and ethnicity group is missing in regards to COVID-19 deaths. And these are numbers that have increased since the summer. So in the summer, we were looking more at race and ethnicity data being available for about 30% of cases, 40% of deaths. And so these are considered improvements, but there's really a lot of progress to be made in this regard. So a little bit about the timeline of why racial inequities of data became really important in the US over the course of the COVID crisis. The New York Times actually sued the CDC to make available federal data that was broken down by race. And so then they did this analysis, and you can see here that Black and Latino groups in comparison to their white neighbors are disproportionately impacted by COVID-19 across all age groups. And what's not noted here is also Native American communities, such as those in the state of Arizona, which is where I'm from, who have also experienced pockets of disparity, especially in their different nations, as well as Asian Americans who have also experienced disparities in COVID-19 caseload. They're about 1.3 times more likely to have COVID than their white counterparts. And this is data that was published in on May 28th, and then officially published by the New York Times in July. But these disparities have only continued to grow over the last few months. And so here's a very brief timeline of how there was increased pressure and pushback against the CDC to collect more complete data on race and ethnicity. Civil rights groups were writing letters to the CDC director. In a hearing in June, Dr. Robert Redfield, who's the former director of the CDC, highlighted the inadequacy of their response. So he admitted that there was an inadequate response in documenting the disproportionately high rates of COVID among especially communities of color. And so then the CDC rolled out a COVID-19 health equity strategy in July. So starting the conversation on how to reduce COVID-19 disparities, and primarily by collecting demographic data broken down by zip code. And then in August, there was a requirement imposed on states that race and ethnicity data to be collected alongside COVID-19 tests. And this wasn't rolled out uniformly across all states, but at least started the conversation on how to collect more racial and ethnic data. And now when you go on the CDC website, you can play around with many different tools which highlight various impacts of COVID-19 on different groups, including the Social Vulnerability Index. You can also look by county. So here's Maricopa County in Phoenix, which is where I was born and raised. And you can explore, using the publicly available data, how COVID-19 is impacting particular parts of the United States disproportionately. There's also data on specific at-risk populations, such as those housed in correctional and detention facilities, who are also experiencing disproportionate impact of COVID. So very interesting now to see this data, but we're still a long ways from having complete equity in terms of data collection. And so what are the implications of this? What was the data not telling US policymakers? Without access to racial and ethnic breakdown of data, policymakers didn't know where to increase access to testing, healthcare, and now with vaccination, where to roll out vaccination. It also doesn't address underlying disparities that were leading to disproportionate COVID-19 impact in the first place, including access to healthcare, density of households, unemployment, and types of employment, especially communities of color making a large component of the essential workforce, and then the pervasive discrimination that underlies the US health system to begin with. And there are also individual and community level barriers to care, such as mistrust and fear of government officials and physicians and scientists more broadly in these communities, limited access to up-to-date and quality information, and being prone also to mis and disinformation. Vaccine hesitancy is a thing that's been pervasive since the beginning of the pandemic, and now even more so, and also lack of access to culturally and linguistically sensitive healthcare. And so now what we know, especially after some more rigorous research studies have been conducted, and I encourage you to look at these open access articles in the Annals of Epidemiology by Millet and Rodriguez-Diaz, they've highlighted how COVID-19 has disproportionately impacted communities of color and especially essential workers. And we see now that Black Americans have been dying from the virus at a rate nearly 2 times higher than whites, and for Latinos and Latino Americans over 2.3 times higher death rates. Here's the data breakdown also for vaccination that's released by the CDC, percent of persons vaccinated as of yesterday, with 1 dose on the left and then with 2 doses on the right. And we still have about 50% of data missing in terms of race and ethnicity breakdown, which makes it very difficult for the Biden administration, who is pushing for racial equity in vaccination. The data is lagging far behind. It's making it very difficult to prioritize certain groups, and this is being covered very widely in the media. So this leads me to how is the data situation looking in Canada? And so I've been doing my own exploration in comparison to the US context. And what's really interesting is that data disparities in the US really urged and pushed the conversation in the Canadian context. And a couple of studies have come out to say that the Canadian government has no plans to release data on the race or socioeconomic status of COVID-19 patients, and that a lot of researchers have been basically using census data to really identify where COVID-19 disparities are happening within the different provinces across Canada. Thankfully, in October of 2020, the Chief Public Health Officer of Canada put out a report that addresses the disparate impact of COVID-19 on particularly racialized populations. And here's a framework that was proposed by the report regarding a health equity approach, which I thought was really interesting and differed from the sort of the US approach, which didn't address this component right here in the middle, which is how to change awareness and really shift values and attitudes around health equity. We've been having conversations in the US, it's implied, but I mean, to really highlight this as a part of the framework between crisis response and finding new ways of living, working, and impact and intervening, I think this is critical and should have a really important impact. And I highly encourage you to take a look at the report if you get a chance. It's published on the Public Health Canada website. I won't go through this in detail. This is a busy slide, I understand. But I just wanted to highlight that different cities across Canada and different provinces have been collecting data on race and ethnicity regarding COVID-19 cases. And I'm really interested in refugee and migrant health. That's my area of specialty. And reports have already identified that there's been a disproportionate impact on refugee and immigrant communities in Canada. And really interesting reports also talking about structural racism underlying disproportionate impacts of COVID as well. So in summary, I'll wrap up really quickly, is that disparities in racial and ethnic data, as well as other kinds of health disparities and barriers to accessing healthcare, remain key challenges for both countries, both the US and Canada. And the goal is really to create and model for each other best practices that reduce the disproportionate impacts of any disease, not just COVID, because this will enhance economic strength and really the human security for nationals of both countries. And so plans moving forward are really to use kind of this retrospective approach, looking at what's happened in the past, as well as prospective approaches to looking at how research and policy can highlight the importance of both health and non-health policy interventions, including looking at immigration, labor, and social policies that can improve access to care and testing for these individuals. So thank you very much. Here are some resources for you to take a look at. If you'd like, I highly recommend the report, and please, and looking forward to your questions, please feel free to contact me as well.
Thanks very much, Diana. I'd like to remind people who are listening in that they can post questions under the Q&A function. You have a choice of asking for a live answer or a written one, but we certainly are hoping that people put a lot of written questions down, because we have a reasonable amount of time now after our next presentation for questions and answers. So I'll turn it over now to Tara and to Michael.
Hi, thank you, Greg. I'll start on behalf of the two of us. So we're talking about the pandemic and enforcement, particularly criminal enforcement, which is where we have spent most of our time. So our starting point really for this, which I think is the important part, and then we can pick up the details in the Q&A should someone be interested. But for us, it was really to look at the criminal justice system and the national security system in combination. So how they're related and interdependent. I think that should be sort of a self-evident approach, given what the pandemic has taught us, if we didn't already know it, which is that a lot of these systems in Canada are interrelated and independent, as are most of us. And so to look at sort of them in isolation, as is often happened, at least on the academic side. For example, I will publish something on terrorism, right? And the focus will be on terrorism law rather than the system as a whole. And so to try to bring some of that together, as we're seeing sort of problems from the national security realm creep into the criminal justice realm and vice versa, and then compound pre-existing problems. So in evaluating the enforcement and justice system, which is really the small and pointy end, admittedly, we wanted to think about this national security problem in terms of the system, in terms of national security, where the lines are, where there's crossover and bleeding between the lines between national security and enforcement, and what the system effects end up being on national security. It's broad, but a little bit vague as a starting point, but it allowed us to go beyond, say, Section 2 of the CIPS Act to look at, threats to the security of Canada and look at, yes, those threats, but also at how the system allows us to prosecute those threats and how the system feeds into the prosecution and the criminal justice system, and then the criminal justice system either provides support for or a barrier to the effective enforcement of our national security operations. We also wanted to do it as best we could, because it was a concern for me from the beginning, in a methodologically rigorous way in terms of identifying what these threats or vulnerabilities or challenges or problems, as we alternatively called them, were. And this was difficult because we're obviously still in the pandemic, and as Diana has just mentioned, Canada is in a number of areas not always great about providing transparent statistics on what is happening within the system. So those two things together made it sort of difficult. So what did we do? We went through an investigation of media stories, crime stats, as much as we can get them, court cases leading up to the pandemic, as well as ones we saw coming out during the pandemic, and discussions with those in the system. And we settled on 3 trends or vulnerabilities or challenges. And those are shifting criminality in times of emergency, increases in extremism and the types of extremism that we saw, and then Canada's overstretched justice system and the corollary, the need to rethink the procedures day to day. So I will now turn it over to Tara to discuss the shifting criminality issue first.
Thank you. So as noted, as a result of the COVID-19 pandemic, there was a distinct shift in criminal offense landscape, particularly when it came to opportunistic crimes. So by this, we mean that as government mandated social restrictions continued to be implemented, crimes such as breaking and entering and robbery shifted downwards as more people were staying at home. However, this also means that as we began to live in a virtual world, there was a significant uptake in cyber-related offenses, including online fraud, identity theft, and financial scams. So it's important to note that this shift towards online crimes was already occurring before the start of the pandemic. The pandemic just served to exacerbate this problem. So a key takeaway from this noted shift in opportunistic crime is that it comes with a very real necessity to have a simultaneous shift in the placement of enforcement resources. The complexity of these cybercrimes is only increasing, and this will require a deeper level of financial and technical literacy in order to conduct proper investigations. This rising complexity of crimes, combined with the personal stresses which already pressure those working to balance life in a pandemic, could start to take an acute toll, resulting in more human resource and skills constraints. Prosecutors cannot operate in silo, disconnected from the rest of the system, as the combined threat of cybercrime and state-based interference is reaching a critical point. For example, in 2020, the Canada Centre for Cybersecurity reportedly took down 3,500 online accounts that were fraudulently representing the government of Canada. To mitigate this, there must be a deliberate reprioritization of justice system resources made without time constraints, pressures, or demands that occurred during this emergency. So this could range from improving access to financial or technological investigative means, to hiring more prosecutors with higher levels of expertise, to even balancing court time, much like Minister Lametti did when he recently announced the legislation to reduce prosecutions for low-level drug offenses. In this way, although the pandemic has served to exacerbate already accelerating criminal trends, it has also provided an opportunity to reevaluate current prosecutorial priorities. Thanks, Mike. That's back to you.
Great. So picking up on that, the second theme or vulnerability that we identified were the systemic impact of the increases in extremism. So I don't think it should come as a surprise to most of this audience that the pandemic coincided with and almost certainly increased various forms of extremist activity and behavior, from the far right to QAnon and anti-maskers and other burgeoning conspiracy theories. There's also now research to confirm a lot of our, what I think is probably a lot of our intuitions, which is that the audience, as it were, has been primed to listen to this message. And so in the results, we have an increased extremist environment. We have accessible technology available to spread any messages. And we have a general public that is both online more, and in some cases, at least, more primed to hear the message. So this creates for the criminal justice system a host of problems: more criminal and quasi-criminal cases to follow, more new and emerging threats to stay on top of, more resources needed in a system that depends on humans for the bulk of the work, a different skill set required for, at the very least, the prosecutors, more court time required to deal with a host of less serious, or at least less violent, anti-mask health violations and other such health violations. And then on top of all of this, any extremism cases that might arise, which tend to use a disproportionate amount of court time to resolve. We've proposed two broad solutions to deal with this problem going forward. The first is we went very broad, and that's the need for a deliberate plan for prioritizing prosecution. So in my areas, at least, we've spent a lot of time talking about when the last time GAC had a real white paper on foreign policy, for example. I would offer the same thing on the prosecution side. We have thousands of crimes in the criminal code. I think the reality is that many people in Canada commit a crime that no one knows about. They don't know is a crime, let alone that they're committing it every month. And they're not all prosecuted, right? And we can't prosecute all of them. And so we're already prioritizing, but it's implicit. And so I think the time has certainly come now to make this more explicit. And so the Public Prosecution Service of Canada, for example, already started this during the pandemic, right? They already said fairly early on that they wouldn't be prosecuting, depending on some circumstances, certain low-level drug offenses, so personal possession drug offenses, and then they gave some exceptions. So really good stuff in that regard. We've also seen just last week, Bill C-22 amending the criminal code to deal with, again, a lot of drug offenses, which are taking up a lot of time in the system, and the reintroduction of conditional sentences, which we can talk about, but are really, really important here. And then we've seen earlier, pre-pandemic, something that I think might be relevant, and that's the idea of the director of terrorism prosecutions. So depending on how that's rolled out, that might help with the extremism angle. But we think it's time to take a broader look at some of these prioritizations and make them more deliberate and more explicit. There's two sides to this, right? There's the what should we be doing and what shouldn't we be doing. So that includes looking at so-called administrative offenses, bail violations, that sort of stuff, which our statistics would indicate are taking up a disproportionate amount of time and money in the system, which means that when you're trying to prioritize whether to enforce health violations, for example, you're doing it within an already constrained system, which perhaps is dealing implicitly, though not in a planned way, already with a host of violations, which may or may not be more important, those bail violations, et cetera, than the health violations. The second major recommendation that we had was to revisit our approach to terrorism and extremism more broadly. So we're now 20 years in since September 11th, since we brought in our terrorism offenses. We now have a host of data about how that's going. Generally, prosecutions have been pretty successful. We know where some of the weaknesses are, and it might be time to do a real review of that. In particular, we noted that ideology seems to be playing an odd role in terms of the court cases, which is that it is both an element of the offense and it is something that we haven't defined in criminal law cases, and seems to be doing very little in terms of either determining what is terrorism or what isn't, at least explicitly. And I mean this by saying that both the prosecution doesn't make an argument for ideology really meaningfully with a specific definition, and the judges don't specifically define it or even introduce it. In fact, often they'll sort of be vague about the basis for which the motive for the terrorism exists. So that was the other main issue that we thought time to get a handle on that before we move forward, particularly if there's another emergency, because the other thing we saw coming out of this was the attempts at the police levels, at the lower levels, to figure out when an ideology amounts to terrorism has been pretty difficult and possibly in some cases slow. And my guess is that's because they've gotten no guidance from the criminal code, parliament, or the court system. So a little sympathetic to them in that regard. Okay, I will pass it back to Tara for the final issue, which is our overstretched criminal justice system, which really compounds the rest of the issues we're talking about here.
Yeah, exactly. Thank you. The closing of the courts due to COVID places significant burden on already strained system. For example, provinces like Ontario are believed to have as many as 30,000 delayed cases, coupled with 18 vacancies across the court system, and these desperately need to be filled. The shortage of members of the justice system is felt across Canada, and coupled with the economic blow of this pandemic, the courts are simply not equipped to deal with the influx of cases that are expected to arise once the dust settles. Some courts do not have the tools necessary for remote court appearances, while prosecutors and other government workers must contend with using remote access to reach many individuals and agencies at the same time. Factors such as the Jordan Principle, which sets appropriate trial timelines, have potential to cause further delays to court resources, which could start to result in hundreds of cases being thrown out in violation of this principle. We are still waiting for Parliament to consider the Jordan decision by taking a broad look at the funding and efficacy of the criminal justice system and relieve these stresses on the courts. The response to resource problems, however, does not end here, as issues of online security while accessing remote government and court systems are still at large. By this, we mean that a secure connection does not necessarily mean a safe connection, as government systems online are still vulnerable to crashing or being slowed by bandwidth or other technical issues. There's been a noted uptake in foreign agencies' willingness to intimidate and take direct action against Canadians, and the need for an increased awareness of personal online security cannot be ignored. So translated to a day-to-day level, while commissionaires continue to protect office buildings, working from home does not afford the same protections for a host of workers that need it now, many of whom are now carrying more sensitive data than ever before. In this way, a directed move to more innovative and secure technology in the criminal justice system will improve public access to justice, free up court resources, and that will lead to lower costs, faster trials, and reduced store and timeline issues.
Thank you.
Okay, I believe that finishes our preliminary presentations. There have been some questions about the book that was referred to, and this is a book that's coming out later in the spring. It's co-edited by Leah West and Amar Amaransingham. It will be published later in the year. The chapters that are going to be include today's presentations, the roles of CSE, CFINTCOM, disinformation, the impact on the intelligence community operations, and other topics of this ilk. There are other talks coming up in this series in March and April that will feature other chapters, and there'll be details coming out on Twitter. This is all part of a project that is funded by SSHRC. So you can tune into this series and you'll find more information as we go along. I don't see too many questions coming in as yet, so I'm going to pose one to our panel. You've come out with a good analysis. You've come out with a lot of ideas. If a senior government person came to each of you now and said, we're pretty sure that in 5 years we are going to be hit with another pandemic of the dimensions of the current one, what is the one thing that you would say to that official that they must do to get ready, especially since they believed they had the time to do something that needed to be done thoroughly? It's open to whichever of the panelists or all who want to reply to it.
I'll go ahead and jump in on that one. I think because it was sort of the thesis of my presentation, which is really prioritizing the collection of data across all different racial and ethnic groups, making sure that no group is left behind, so that when policymakers do want to create interventions or prioritize certain parts of the country in terms of access to testing or access to healthcare and supplies even, that they know exactly where to begin. So I think the importance of data cannot be underestimated, and that's something we've learned from the COVID pandemic.
Would any other panelists like to comment on the question?
I can jump in on the criminal justice side, and I'm sure we can take a little more time, perhaps in the follow-up blog. We'll think a little bit more about that one and sort of try to come up with something for immediate action. But I would say one of the things, at least coming out of the statistics that we were managed and media stories and in talking to people, the stuff we were managed to cobble together, I think the idea was, you know, we reacted on the fly during the pandemic. And this is an opportunity to maybe take a little bit more time and be a little bit more planned in terms of our Canadian reaction. So part of me wants to say, you know, I'm sure there are some stuff that you could do really quickly but the other part of me wants to say, well, maybe don't. Like, maybe this is the opportunity to say, you know, what we learned out of this was we have to be a little bit more deliberate in our prioritizing and planning with respect to both extremism and the justice system more broadly. And so that involves looking at statistics on the very types of stuff that Diana is talking about in a very different context, right? But moving that over to the criminal justice system, it involves taking a broader look when we're done at a lot of the stuff that Tara and I have put together. But it also offers an opportunity to take a broader look at our system and really plan for the next steps, because I think that planning is what we saw more than anything. It was systemic lack of planning over a long period of time with respect to the system is really creating the vulnerability, sort of death by 1,000 cuts.
Any other comments, or we'll turn to some of the questions that are coming in?
I can jump in with one quick thing, which is to say, if I were to talk to the CBSA, I'd say one thing that we learned is, I kind of think that with respect to the deportations program, you made the right decision, and kind of contrary to the situation in the criminal justice system, the lesson I hope the CBSA learns is it's okay to be reactive and okay to be quick to some of these things. What the CBSA, what they saw was a significant and substantive impediment to their program was developing, and very quickly backed away from immigration detention, very quickly backed away from the coercive tools which were available to them, because they recognized that they didn't need it. And we can contrast that to what happened in a number of other countries around the world where immigration detention levels did not drop as significantly, where coercive tools were maintained when they didn't need to be for the sake of the program. So my lesson is you kind of got that part right, and it's good to be reactive and good to be able to make some snap decisions sometimes.
Great. Julianne, do you want to add anything here?
No, that's okay. I'll leave it.
I know you've been getting some questions to answer in writing.
Interesting questions coming in the chat. So.
Okay, well, there's one question here that was posed as a possibly written question, but Simon would like to answer it. So I'll read it out and then turn it over to him. With regards to the moral imperatives that COVID may have introduced to the immigration removals program, and whether it should encourage us to rethink as soon as possible, the as soon as possible provision, do other tools like humanitarian and compassionate grounds not suffice to take these considerations into account?
Yeah, so thank you for the question, and it gives me an opportunity to take time when I ran out of it at the end of the presentation. Let me back up though and just sort of explain what a humanitarian and compassionate application is and into relation to deportations. So almost every person, not every single one, but almost every single person in Canada without status is allowed to apply for permanent residence from within Canada under the humanitarian compassionate exception. It's a whole separate program. The problem with humanitarian and compassionate law right now is that you can be deported while your application is pending. And these applications can take 1, 2, 3, 4 years. And frankly, if you are deported while that application is pending, it's not going to be granted. So what we do on my side of things, on the immigration and refugee bar, is we ask for deferrals. What I'm kind of arguing for here is a blanket deferral for all sorts of people who have H&C applications in the system, because if the CBSA just starts deporting people with H&Cs in the system, those H&Cs are mooted out and they won't be granted. So my ultimate pitch is for people who want H&Cs, just give them an automatic deferral to make that H&C real and to give them a real chance to obtain status.
Okay, and Wesley Wark is asking Julianne if she's what she thinks of the terms of reference for the evaluation of GFIN, and does she feel that GFIN is an organization that for which there's no real alternative?
Thanks so much for the question, Wesley. I have taken a brief look at the terms of reference for the independent evaluation. I guess my only comment is that, I mean, perhaps fairly, the terms of reference refer to, its current contributions to the COVID-19 response and is forward-looking, and that perhaps that would discount, a historical legacy where GFIN has made pretty significant contributions to, responses from the SARS epidemic in 2002 to 2003, to H1N1 in 2009, and also in MERS in 2012, the GFIN played quite substantial roles. So yeah, maybe just in that, holistically taking a look at what the potential contributions could be would necessitate also considering the past and maybe also the current political and fiscal limitations on its capacity since it's been sort of quote unquote downgraded in recent years. Do I think that it needs to be maintained as a Canadian state-based event surveillance system? Yeah, I mean, that's an open question and certainly a question to the Canadian government and to the world about what they want epidemic intelligence to look like moving forward. I think the fact that it was hosted by the Canadian government when it was initially created lended to its legitimacy and its political traction. You know, in 2005, in the mid 2000s, GFIN was contributing up to 40% of the epidemic intelligence gathered by WHO. So having a government funded platform is certainly beneficial for certain reasons. GFIN is part of the WHO EIOS, so I haven't, you know, read a lot about that system and wouldn't be able to comment on the nuances, but I think it is worth mentioning that, you know, as an international organization, the WHO's capacities to maintain and invest in such intelligence systems really depends on buy-in and contributions from national governments. So I don't think it's a question of one or the other. I think it's a question of how the world wants to invest in this capacity moving forward. And the question of the private sector, again, I think comes down to maybe also partly moral and philosophical discussions of whether our ability and our capacity to collectively respond early to these types of events is a global public good, and what the implications of it being held as a responsibility by the private sector might be. I know that it's something that the WHO and other UN institutions have certainly grappled with in the past.
Thanks. We have a very concise, precise question from reporter Jim Bronskill. To what extent should security intelligence agencies play a role in sending up early warning flares about an emerging pandemic?
I guess
Not addressed to any particular panelists, so go ahead, whoever wishes to.
I mean, I can jump in, I guess. Maybe it's particularly relevant, although I'm not an expert in security studies. My background is in international relations and certainly in the more global dimension of it. I think that's a question for, you know, national governments in terms of how to balance the capacities and mandates of different ministries. I think it is a question that will come up in the review of the Canadian response to COVID-19, as it probably will come up in the review of many national responses and global responses to COVID-19. How do you meet the worlds of health and security in a way that protects human rights and promotes health, but also leverages, you know, the full capacity of governments?
Okay, and I believe that question, Jim, is going to be addressed in other chapters in the book. So next question, do any of the other panelists want to answer, to chime in on that last question?
Yes, very quickly. It's actually an excellent question. I'm not a security expert myself, but just thinking about how the response rolled out in the US beginning in March of 2020, there was a lot of criticism that, you know, the administration itself didn't reveal what they knew earlier on during the pandemic. And I mean, it's quite difficult also to balance with, you know, how information is disseminated to the public, especially very early on when a lot is still unknown about how the virus spreads and what precautions you're meant to take. So I think there's an important balance to strike between, you know, making especially multilateral agencies or those at the federal level aware of the potential threat of the pandemic, but then also making sure that the public is well informed and know exactly how the disease is going to spread and what contingencies to take. So very important balance to strike. And I think we've learned that in the American context at the very least.
Any other comments on that question? Okay, the next question is somewhat along the same lines, but much broader. The events of 9/11 led to systemic change in security practices in aviation and elsewhere. Is systemic change likely to happen with COVID-19 in the years to come, or will governments stick with the status quo?
I think it's certainly our hope that governments will take the time as soon as they're able to listen to the recommendations that are coming up. It's impossible to say for sure, but hopefully this pandemic was on a scale that has highlighted the need for a response at a broad level to address these concerns.
I just say in passing that whenever anybody looks at the history of the intelligence community in Canada, 9/11 stands out as a turning point in terms of attention to security intelligence, in terms of funding for agency, in terms of reorganization of government. So it was really a very, very significant event. And I think it's a very pertinent question to ask if this could be the same. Other panelists?
Greg, can I jump in with a bit of a warning here, just to follow up on Tara's comments, which I think are bang on, which is that when we're talking about systemic change, there's sort of the deliberate systemic change that you saw post 9/11 in terms of Canadian policies and legislation and practices. And then there's systemic change that happens regardless of whether a government engages with an event and responds deliberately there too. And so one of the hopes that we were looking at was that that systemic change is done deliberately, because one of the concerns we had was that you're going to see systemic change and have already started to see it, right? So the pandemic, it's not that cybercrime was new. It's not that extremism was new. It was that it was compounded and it exacerbated trends that we were already seeing. And some of those trends on the criminal law side, at least, are ones that go back forever, right? Which is that the majority of crimes will not be the most violent murder crimes, they'll be opportunistic crimes. And what is an opportunistic crime will depend on the age in which you live, right? So pre-COVID, opportunistic crime that happened a lot was someone gets wallet stolen from a pocket or purse or whatever on a subway. And that doesn't happen during COVID, but we see more cybercrime, online scams, money scams, right? Because more people have access to the computers. And so I think you're going to see, it was already a trend. We were already seeing a decrease in one and an increase in the other, and this just sped it up. And so, yes, we will see systemic changes. The question is whether it's deliberately responded to by the government, I think, at least on the criminal justice side, to some degree.
Yeah, very good point. And when we do look back at the history of 9/11, part of the aftermath of that was the invasion of Iraq and a totally transformed strategic situation in the Middle East. That may not be repeated in exactly those grand terms, but of course we can already see geopolitical arguments and blame and shifts in who believes what about the origins of the pandemic that could have significant impacts later on. Next question turns to the question of migration. Do you expect more migration and refugees coming to Canada afterwards? And do we have the health and legal system in place to handle what could be a significant increase in immigration to Canada?
I can go first here. So two parts to the question. Do we expect more people, and then what's our capacity to handle any uptick? Question marks for both of them. It's early days. So I think we all expect that there's going to be more global instability post the pandemic, particularly as vaccines roll out unevenly across countries, across regions. Who knows what that's going to produce? Who knows what economic growth is going to look like all around the world? Who knows how it's going to impact pre-existing global conflicts? The other thing, though, to balance, regardless of what is happening around the world, is will people be able to move? What's going to happen to air travel? Is it going to resume at the same sorts of levels? Will people who are at imminent and real risk be able to relocate to a different part of the world? I don't know. And I think it's probably likely that it's going to take a while for global aviation to return to the same sorts of levels as we had pre-pandemic. In terms of the legal system, there are a lot of things that we don't know that are about to change. We don't know what's going to happen in the Federal Court of Appeal with respect to the Safe Third Country appeal, and that could impact things. In any case, though, I think we've learned over the past year or two that while there is a backlog, Canada has been working its way through that, and there has not been any sort of significant or sustained strain on Canadian institutions. So I'm not particularly concerned about that.
A number of the questions coming in are suggesting typed answers. I think in some cases this might be because people haven't made a choice, but it would be great if you could specify that you want a live answer and keep the questions relatively short. But I'm going to read one. I think this is, no, that's an answer that's coming in. Just a second here. Yeah, I don't see any new questions here. So if you have one and you're anxious to get on the list here, this is the time.
Maybe while we wait, Greg, I'll just jump in on the 9/11 question as well from a
Yeah, please do.
public health perspective. You know, I would find it hard to imagine a world where there aren't some systematic changes to how we handle global public health and intelligence disease reporting moving forward from COVID-19. One of the main impetuses for the creation of the Public Health Agency of Canada and for the reinvestment in GFIN was the SARS epidemic in 2002 and 2003. These types of, global health emergencies sort of have a way of boosting impetus for change. Whether or not that will be, I guess, systemic or just in the short term is yet to be seen. In terms of, the aviation agency and travel, one of the other projects that my co-author Kelly Lee and I are working on is looking at how travel and trade is being regulated in response to COVID-19. It's a project called Pandemics and Borders, and I think we're going to see incredible changes to how the aviation agency and in general global travel is managed moving forward. So that's just a short answer.
Great, thanks very much. I don't have more questions at the moment, but I suspect that there were things some of the panelists might have wanted to say if they had a few more minutes. So I'll start with, I'll go in reverse to the order we opened up with, and I'll ask Tara and Michael if there's anything that they would like to add to what they said in their presentations or in their answers to questions.
Yeah, not much. I guess the one thing we talked about that we didn't get into and would take longer, but we'd happy to take questions on are sort of what exactly was it that drew us to the ideology component and the definition of terrorism and revisiting it. And the other thing was the system problems in criminal justice in Canada are pretty widely known. We literally have a Supreme Court case, Tara mentioned, R versus Jordan, which was an attempt by the Supreme Court to deal with a justice system that frankly just the Parliament was not dealing with in terms of money and efficiency, right? And so the Supreme Court literally made up timelines sort of out of the blue, frankly, to deal with some of these problems. So it was fairly clear on that end that we had these pre-existing problems. It was fairly clear that they were compounded during the pandemic, the resourcing issues. What was probably less clear, I think, was that extremism component and where exactly we focused our attention. And again, we focused our attention on the definition of terrorist activity, on ideology, on the motivation component, on what makes something terrorism rather than assault, for example. And the other thing we focused on was the shifting criminality, and Tara got into some of them, but there were a number of shifts in that criminality that we thought were pretty relevant and which actually, when we looked back, were fairly consistent with the slower shift that had been happening over time, right? So cybercrime, originally we had looked at misinformation and sort of other crimes that might be able to fit into some of that sort of activity. We looked at money crimes, right? So a lot of the cyber was cyber fraud in particular. We saw more extremism, and then we saw less, home invasions. And so that was one of the things where initially we just dismissed it and said, well, there's less home invasions for obvious reasons, which is everyone's at home, so you're not going to go into a home full of a family, right? Those tend to take place when people aren't home. But I'm not sure we should be so dismissive after having thought about it of that trend. If people continue to work from home, if remote work continues to be a thing, then that might be a crime that we see less of. And I think it's probably not alone in terms of some of the crimes that are shifting. They won't disappear, but will shift. And I think that has implications, from the top in terms of what we're prioritizing. What do we think is most important, right? We can't prosecute everything, as we said to start. So when there's an anti-mask protest and people say, why didn't you prosecute all 100 people? I mean, there's a simple answer: we can't, right? So how do you prioritize that with other things in the system? And then the really low level, which is those priorities have to coincide with human resources skills. So if we're going to tackle cybercrime, if we decide that's a priority, where's the training right now at the Public Prosecution Service of Canada or provincial prosecutors on cybercrime right now? How are intakes on the HR side for Department of Justice, right, the Legal Excellence Program in Ottawa? How are they determining that they are going to get people who want to do litigation into that program, who also have the business skills, the financial skills, and the tech skills to really get up to speed on those crimes, if that's what a priority is? And I think that's the other side of it we have to look at, right? The very high level, what's a priority, and the real low level, nitty gritty human resources. So that was something we didn't get into as much in detail, but we thought was really important.
Thanks, Michael. I'll interrupt going for closing statements because we do in fact have a couple questions here, and there are two different people and I'll read them out. To Ms. Piper, given the situation with GFIN, do you think government's public health systems need closer ties to their intelligence communities after this pandemic? And if so, how would this be structured? And to Ms. Reyes, the Biden administration has indicated in recent weeks through executive order that it wants to build a similar system of its own that appears to be similar to Canada's GFIN. What do you think this signals about the US administration's mindset on public health intelligence going forward? So Julianne first.
Sure. Yeah, thank you. I mean, I guess it's a difficult question to answer because I think that, what's demonstrated when you take a look at GFIN is that PHAC, or the Government of Canada, had public health capacity to mobilize epidemiological intelligence already. I do think there is a need to not continuously create new initiatives, but instead look how we can better connect the capacities that we have among different departments. And I do think that there has been a lack of clarity in some ways around who's sort of on point for which aspects of this pandemic response, in Canada, but also beyond. So the question of how a stronger connection would be structured, and how to leverage both security capacity and public health capacity in a way that, is mutually beneficial without violating the trust that people have in public health, and without eroding some of the other public health mandates of PHAC and Health Canada. Yeah, I think that's a question that needs some further attention and research. Good,
thanks. And Diana.
Sure. Yeah, thank you, Julianne, for that. And I think it's really interesting because I haven't learned a lot about GFIN, but I'm just starting to pay more attention to it now that the Biden administration is looking to model something that can prevent and help respond to biological threats within using and capitalizing on information from the intelligence community. And I can't see why not a future center or like early warning system couldn't be a collaboration between the US and other countries like Canada in order to gather intelligence on potential global health threats. And I did want to follow up on Greg's offer to kind of give a closing kind of a statement and way forward is that the Biden campaign has made many promises in terms of prioritizing different ethnic groups within the COVID-19 response, which we're now trying to see in terms of the vaccine rollout and also increasing access to healthcare more broadly. And also establishing a health equity task force, which focuses primarily on expanding reach of COVID-19 testing and then also vaccines for particular ethnic groups. And I think this is in line with, some of the frameworks that have been put forth by the Public Health Office in Canada. And I think we can continue to learn from one another and model each other's initiatives.
Thanks, Diana. I'm going to zigzag here through questions, closing statements, because I think all of them contribute to people's knowledge. And we do have a question from Xavier Furtado. Are there other countries from which panelists would suggest as good models in collecting current and accurate data? And are there models specifically that Canada should be looking at?
Sure, I'll take that one. Something that came up in my research was data that was being collected by countries in Europe, particularly Germany and Sweden, who already collect a lot of data as part of their health system and access to information that's made available uniformly across the different health systems in the different provinces. So that was noted as a potential model for Canada, which also has a very national health system, which can centralize information regarding patients, at least that are entering into hospitals or seeking care at clinics. And so I think that's one suggestion. I can't say that the US is a good model in its current state, but at least there's an effort to increase highlighting certain disparities and impacts on certain groups.
Thanks very much. To zigzag back to closing statements, Tara, have you anything you wanted to add to what Michael said?
Not really. I would echo everything that was said. I think we are very likely, this isn't the last pandemic that our nation is going to see, our world is going to see. And we know that based on our past and just the likelihood going forward. And I think this is just really a time to take these recommendations seriously, and it goes from the day-to-day, as we've suggested, up into very high, broad policies, but they're all going to work together because we have been given a chance to do that now. And I think we're trying to highlight that it is very important that we do take action on this going forward.
Thanks, Tara. Simon, do you have some closing comments?
Only one, and a little sort of tangential to what I was discussing, but I was stimulated by listening to Michael and Tara. One thing where I think our presentations intersect, and something for us all to pay attention to going forward, is Michael and Tara pointed to the changing face of extremism during the pandemic. And in particular, I'm thinking most recently about the designation of the Proud Boys, a place where this may manifest early and where we can sort of pay attention to the security community's response is in deportation law, where being a membership of a terrorist group can be grounds for deportation or exclusion. And those proceedings can happen much more quickly than in the criminal justice system. May be a spot for us to watch for this dynamic in particular that Mike and Tara identified, and sort of think through how it may play out in other systems. But we'll all sort of be part of the question of how the CBSA comes back online after the pandemic. Is it going to be oriented towards just removing all the people who were not removed during the pandemic, or will it sort of orient towards this new challenge of the different type of extremism that we saw, right-wing extremism that we saw emerge during the pandemic? A closing, which is really just a bunch of questions. Thank you.
Okay, Julianne, you've had a good workout here in terms of the questions that have been directed to you and your specialization with GFIN, but is there anything that you want to add?
Sure, maybe just briefly to reiterate that, you know, when it comes to public health emergency, global public health emergency of this nature, and so many other health or security threats, I think we need to be careful not to be too inward looking in how we move forward in national security policy or health policy that comes out of this. I mean, it's really about, you know, existing as part of an interconnected world and a global community. And I think in the past, Canada has been a strong champion of multilateralism in global health, and that, you know, the best lessons learned moving out of this crisis are going to be ones that recognize the need to find a global health security, whether that's through championing the World Health Organization or some sort of other multilateral initiative. So that's just what I would end on.
Thanks very much, Julianne. I'm going to turn it over to Thomas Juneau, who is one of the editors of the book that has given rise to this series, who'd like to make a few comments. So Thomas, over to you.
Thank you very much, Greg. I would just like to thank everybody who participated today. Thank, obviously, the speakers for very good presentations. Like Greg mentioned, there's a co-edited book that will come out of this later this year. You saw some of the chapters today. There's an event hosted by Carleton in March, and another event like this one that will be a CIPS and CASIS event in April. You'll see details on Twitter and elsewhere in the coming weeks. These will feature other chapter authors from the book. But before we finish off, the last thing I want to do is to thank Greg. As Greg said at the beginning, this is a joint CIPS and CASIS event. CIPS is the Center for International Policy Studies at Ottawa U. They are the ones hosting the technology for this event. So thank you very much to the CIPS folks for helping us at your end. But it is also a CASIS event. CASIS is the Canadian Association for Security and Intelligence Studies. It is a venerable organization that has done a lot over the years to organize public events, public conferences, brown bag lunches, and so on, to encourage public discussion of security and intelligence issues in this country. As you know, there is not a lot of that in Canada. CASIS has been one of the very few that has tried to fill that space between government and academia. It has played an invaluable role over the years. Greg has been president of CASIS for almost 10 years. He has done more than anybody to save the organization, actually quite literally, from near collapse a few years ago. He has been the driving force behind the organization of annual conferences, of which we did not do one this year because of the pandemic. All of the smaller things that CASIS does left and right, it is largely thanks to Greg and a few other people around him. Greg decided last year that he wanted to pass the torch of the presidency of CASIS. So as some of you might have seen on Twitter, Jessica Davis is now very recently became the president of CASIS. Jessica will chair the next joint CIPS CASIS event in April. So this was technically Greg's last event as, I mean, technically no, because he stopped being president of CASIS 2 weeks ago, but you know, let's forget about the details of the dates for a second. It was his last event. So Greg, on behalf of CASIS, of Lori in particular, and the board and the membership and everybody who's attended a CASIS conference in the last 20 years, and that probably includes something like 90% of the whole security and intelligence community in Canada, because my guess is that most people have attended at least one event over the years. You have done a huge service to the community, to public discussion of security and intelligence issues in this country, of which, again, I cannot emphasize enough, we don't have enough. So thank you a million for that. Greg has agreed to remain as a member of the board of CASIS, and that's great. We will be very happy to continue hanging out with you in our occasional meetings and conferences. But again, I cannot emphasize enough how we are all grateful for everything that you did for CASIS, but beyond CASIS, for public understanding and debate of security and intelligence in this country. So thank you a million. And obviously, thank you for the event today. So on that, I am assuming that we will close the debate. I don't know if, Greg, you want a last word or before we finish off.
No, just thanks, Thomas, for all of your support over the years and for being the mover behind this event. Thank you.
Okay. So thank you very much. Thanks again to the speakers, to Anna and the CIPS folks, and hopefully stay safe. And we'll see you either at the March event in Carleton and the April event like this one. Thanks a lot. Have a good day.